Good afternoon, everybody. Welcome to our COVID-19 update. We come to you on Mondays in this format to give you an update on what's happening in the Chippewa Valley related to COVID-19. Today is Monday, June 29th. It's hard to believe we are near the end of June. But again, thank you for joining us. I hope you were able to enjoy the summer-like weather this weekend. As summer continues, I know it's hard to not want to just be back to normal, to do all of our normal activities with friends and family, to be out and about. But there's still risk. The virus is still causing challenges in this community and across the U.S. There is risk in gathering in groups, particularly in gathering in those close situations where we want to be with friends and family. When we don't keep 6-foot distance, when we have people in our groups that are having even mild symptoms and can spread disease, and when we're not wearing masks, we spread this COVID-19 to others. This weekend illustrates what we've been trying to avoid. In Eau Claire, we had 14 cases reported on both Saturday and Sunday and another 10 today. We really are challenged with cases increasing in this community in a rapid way, and we don't think it's going to stop unless we really work on how we keep our circles small, how we keep away from each other in some physical distancing ways, and how we make sure that we use a cloth face covering to protect others, not just to protect ourselves. A lot of the cases that we've been seeing in the last couple of weeks could have been avoided by keeping that distance, especially in those small gatherings. Businesses often are doing the right thing. They're putting in place all those practices that are required. Eau Claire, for the most part, I think, is paying attention. And then people are leaving the businesses, and as a small group of employees are going and socially gathering and not keeping distance. It's those kinds of examples that are making a difference for us locally. And we really encourage people to pay attention to the fact that disease will spread if you get close. This is a disease that travels in that way. Today, we'll be giving you the state and local updates. Again, I have Angie Weideman with me to share what's happening in Chippewa County. It's always wonderful to have a public health colleague and a partner in the Chippewa Valley working on stopping the rapid spread of this disease in ways that really can keep our healthcare system and our public health system strong and responding the way you want us to be. I'll give a quick status update on the state, and Angie will share about Chippewa, and then I'll come back and share Eau Claire data and a couple of Eau Claire updates. Both of us will be available at the end to answer questions. So the state update as of today. Total negative tests for COVID-19 are at 527,359, an increase of 5,612 negative tests since yesterday. A total positive case count of 28,000 people, 28,058 people with COVID-19, an increase of 315 positives. 3,407 of those people were ever hospitalized, about 12% of that population of positives, and we are at 777 deaths for the state. Again, important to remember that this disease is impacting all races, all ages, all ethnicities, and we need to pay attention to the fact that this is a disease that is spreading. Angie's going to share a little bit about Chippewa County now, and then again, I will be back to share Eau Claire specific information.
Thank you, Lisa, and thank you to the Eau Claire City County Health Department for having us today. Good afternoon. My name is Angie Weideman, and I am the Health Director for Chippewa County Department of Public Health. I'd like to start with a status update for Chippewa County. Currently, we have 85 confirmed positive cases of COVID-19. 65 people have been released from public health isolation, and 20 individuals are currently being monitored by our health department. Thus far, we have 4,486 negative test results in Chippewa County. And with the 4th of July approaching, and as you make your plans for a long weekend, the health departments would like to ask you to strongly consider the risk of COVID-19 when you are planning. Few items that you can take into consideration are staying close to your home. COVID-19 doesn't know or respect county or city boundaries or lines. Staying close to home will help minimize the spread of the virus. Respect the gathering outlines recommended by your local health department and keep your circles small. If you can watch fireworks from your car or your backyard, that would be ideal. If hosting a backyard barbecue, please keep your gatherings small. You can set up blankets or tables that families can use, and if you set them up in a way that people can socially distance, that will make it easier for everyone who attends. Encourage your guests to bring their own food, utensils, and drinks, and please keep music at a low level. Oftentimes when people can't hear each other, they get closer to each other. So if you have music, keep it low so that people don't have to get close together to be able to hear each other. Also keep a record of who attends any gathering so that the health department could follow up easily if there are contacts that need to be followed up with. We also ask that people wear face coverings when you cannot socially distance, such as if you were at a parade. If you are out on the beach or other public spaces, pick a spot where you can stay at least 6 feet away from other families and households. If beaches or parks look very crowded, you can always change your plans and go to another location that isn't so crowded. And also carry hand sanitizer and frequently wash your hands. And if you are feeling sick, please do stay home so that you're not impacting other people in a negative way. It looks like the weekend is also going to be pretty hot and humid. So remember, other summertime safety measures are important, such as staying hydrated, drinking lots of water, wearing sunscreen, and wearing light clothing and hats with a brim to protect from sun safety. We also do want to let everyone know that as a health department and Eau Claire and Chippewa counties, we do want people to enjoy the weekend while being as safe as they can possibly be. If you have questions, please reach out to your local health department. We're here and we're happy to help people. Now, Lisa will come back and give another update around Eau Claire County.
Thanks, Angie. 4th of July is a fun weekend, and we do hope people enjoy it. It was now, my grandmother was born on the 4th of July. She'd be like 105 this 4th of July, so we always had an extra fun time on the 4th celebrating her birthday. She thought the fireworks were just for her. So, Eau Claire update. Negative tests as of today are 8,215, an increase of 580 since Friday. We now have 218 positive cases for COVID-19, an increase of 38 since Friday. This represents 28 cases over the weekend, as I indicated earlier, plus an additional 10 today. This is certainly a significant increase for us in Eau Claire County, some of our highest case numbers by day that we have had. Of those 218, 149 are recovered. That is, as we've said before, an ongoing tracking piece of information that is available from the state website. Our data is available at our website. That's covid19eauclaire.org. That website has additional information beyond what I've just shared now. A couple of additional updates at a national level. CDC recently updated the list of who's at higher risk of serious complications related to COVID-19. Again, note that we are all at risk of getting the disease. Some people are at higher risk of having those significantly higher negative outcomes, hospitalization or death being obviously the most severe. CDC no longer has a specific age cut point for when the risk is higher. They are indicating now that the risk for illness and severe illness with people increases as the age increases. So it's certainly true that the older you get, the more serious the complications appear to be. So a 40-year-old is at higher risk than a 30-year-old, and certainly a 70-year-old is at higher risk than a 60-year-old. The older we are, the more at risk we are. CDC has also increased the number of underlying conditions that also increase a person's risk of severe illness. Not only are those ones that we've talked about before on the list, but things like cystic fibrosis, hypertension, liver disease, pregnancy, smoking in general, and diabetes are also on that list. A recent study showed that women that are pregnant were significantly more likely to be hospitalized or need intensive care than women that were not pregnant with COVID-19. So we are learning. It's a new disease, and we're learning those areas where the outcomes may be worse and are certainly places where we need to spend extra time protecting those people around us. That information is available at the CDC website. A couple of other additional pieces of information for you. We stated earlier, we've been talking all along, that our local situation can change quickly. We obviously saw this over the weekend, and we imagine that that may continue. Many of you may have seen the La Crosse data. La Crosse was well under 100 cases a couple of weeks ago. They are now at over 400 cases for COVID-19. Rapidly changing situations are something that I think we may expect to see, and I think the more that all of us make the right choices to keep physically distanced, to follow the order that is in existence in Eau Claire, and to protect one another, the better off we will be. Again, even if you're young and healthy, you can spread this disease. And we are counting on people that don't think that this is a big deal because they are not as severely impacted by it, to be the ones that help. When they get sick, those people that are young and healthy get sick and choose to spread the disease by not staying home or not getting tested. They are making choices that impact all of us. So we are really asking the community to lean in and say that we care about each other, and we're going to slow down the spread of this disease. Again, there are healthier things we can do. We're asking you to do those things to generally stay healthy. Enjoy your families over the 4th of July weekend is a positive, healthy thing to do. Eat well, get rest. All of those same recommendations that we say regularly are still in place. But we also have to pay attention to the specific recommendations related to COVID-19. Again, go to our website, covid19eauclaire.org. If you can't find the information and you are part of the general public and would like to know more, you can certainly call our call center number. That number is 715-831-7425. If you've got a specific healthcare question personally, please start with your healthcare provider and call there first. But general information about COVID-19 and follow-up, we certainly want to support you through that call center number. So, any questions that we have today? Angie and I are available. Yes?
Obviously 38 cases since Friday is really significant. I think a lot of people are curious where this is coming from. Do you have any indication of, is it coming from large gatherings, protests, people gathering at bars?
Sure. So the question is, do we have a sense of where our increased caseload is coming from? What we are seeing with the initial investigation, and again, some of these are brand new today, so we're just starting to work through them, is that we are seeing disease coming from a variety of places, primarily, again, situations where people are in close contact with one another, either in the work site, through social activities, or through home activities where they are coming in close contact and spreading the disease because they're not following that physical distance and cloth face covering recommendation. People with mild symptoms are choosing to be out and about and choosing not to follow the public health recommendations. Those are the majority of the situations. There are certainly some outbreaks in other settings and other situations that we're following up on, but it appears that most of our spread is happening because people are not following the order in Eau Claire or the broad public health recommendations that occur in every county. Yes?
So I know on Wednesday you talked about you were concerned at the data before talking about the new order. I guess where do you stand now in terms of being concerned, and are are you thinking of reevaluating the local order, or just kind of where you're at today with that?
Sure. So the question is, where are we at today as a health department? Where am I at as the person that put together the local order and the data that we're seeing? Once a week, we look at our data, the measures that are available on our website. We pull data as of Monday night. We review it on Tuesday, and on Wednesday, that data is put forward as the measures that we are evaluating regularly related to COVID-19, both the disease measures and the capacity measures. We are anticipating our disease measures to look significantly worse again this week. We haven't pulled the data yet, but just based on the number of cases that we've gotten, we are likely to see that. I am glad that local health order is in place in Eau Claire. It does mean that we have some minimum requirements that meet those public health risk factors that exist for this disease. Doesn't mean that it's a perfect solution to stopping the transmission of disease. No, the intention with the local order was never to be the case that we would stop all disease spread, but we have an order in place that is really there to help slow things down, to make sure that we had conditions in place to physically engineer our spaces in ways to decrease disease spread and encourage best practices. At this point in time, we'll see where the order goes next, and that's really going to be based on the data.
And I know you've also said that it's going to take a little bit of time to see just kind of the impacts. So are you, would you be surprised if the numbers kept going up? We've got 15, maybe to 20 cases a day. Should people be prepared to not see these numbers go back down to the 2-3 days that maybe a few weeks ago we were seeing?
Yeah, so the question is really related to what are we expecting related to the numbers and what will happen with disease over time. Certainly, it takes a little bit of time for any change in the order to have impact on disease, and it takes time for transmission of this disease. That's why we have a 14-day window where people that have been exposed, we have those people stay home and be quarantined because they may develop disease during any point in time in that 14 days. We do expect to see diseases continue to be present in this community and the count to rise. We want it to happen more slowly than if we had nothing in place to really do follow-up or have engineering happen to keep the spread small. But I would not be surprised that on Wednesday and next week Monday, if we are not reporting continued increase in disease, just like Chippewa saw last week with 17 cases, certainly their probably biggest number. Angie can speak for herself. We are all expecting to see more disease transmission. We don't have a stay-at-home order. That's not the practical thing to do right now. So people are out in the community and disease will spread. We need it to happen as slowly as possible. That's our goal.
And I guess I know you kind of put the onus on the people and the community members to kind of take this in their own hands, I guess. Where do you think people are at right now? Do you think that there's a sense of, we got through this, time to start opening back up, we don't need to wear the masks? Are you seeing that as that maybe part of the reason that these case numbers are going up? I guess, what are your thoughts on how people are handling this? Because as you said, there's only so much that you guys can do with that.
So the question is, what are we seeing related to public perception with this disease? I would say as a health department here and across the state, we are hearing all ends of the spectrum. We are hearing people see and acknowledge disease spread with a novel virus that nobody is protected against, and we see, and people are paying attention to the southern states where disease spread is rapidly spiking, and we see people say it's not a big deal and I don't really care and I'm going back to my normal practices. So we're seeing across the board perception in this community and other communities. I think one of the strengths we've had in the Chippewa Valley is we've got many, many strong partners here that are working together to do the right thing. The chamber, business community, there are many partners that are seeing that it's in all of our best interest to continue to walk a careful road with this disease, to not open up quickly. There are pockets that are not agreeing with that, and we are seeing spread of disease because of that. But I think we all have the ability, both businesses, individuals, and families, to pause, pay attention and do those things that are going to make a difference. It's not just personal responsibility. I think we have an ability to have a different message out in the community. We have an ability for businesses to step forward and really put practices in place that protect all of us. But we certainly have to do it together. Yeah.
Another question about testing. The cases are going up. It does look like the average number of tests, at least through the month of June, has pretty much stayed the same. Does Eau Claire County need more testing? Are there just not enough people going to get tests? What is our capacity for testing?
Yeah, so the question is really around testing. Our average number of tests done per day, per week has stayed fairly flat in this community. True in many communities right now. We are working on testing strategy locally. We are trying to increase the number of tests that are happening for all symptomatic individuals. We know that there are pockets of examples where people aren't easily getting a test for COVID-19. We do have capacity in this community. It's just making sure that that capacity is utilized fully. We are also working on other creative ways in the community that testing can happen, and we will continue to explore that and look at that. Outbreak testing is one of those places. When we get a bigger outbreak in a business, we are finding ways to bring testing to places, and all communities are doing that. Also, testing in those very vulnerable populations is something that all of our counties are focusing on. So again, those higher risk congregate settings, making sure that residents and employees are tested on a more regular basis. Yeah, so the question is, are there people out there with symptoms that are not getting a test, and should they be going in to get a test? Absolutely, anybody with any level of symptoms should be tested. The reason for that, even if you are not super sick with those symptoms, is that you can spread disease. And so knowing if what you are symptomatic with is COVID-19, so that you avoid spreading that to your grandparents, to those people, pregnant women in your network, people that are more vulnerable. The goal is to make sure that those people that are positive are known, and that those people do not further spread disease. We should all take responsibility for wanting to know if our scratchy throat or our small cough or our runny nose is COVID-19, so that we don't spread to others. We are understanding that not everybody is getting tested, and we certainly want people that are symptomatic to be tested. Yeah. Yeah, so the library, our local library in Eau Claire, is working to do some reopening over the next stretch of time. And the question was, has the health department been working with that facility? We certainly have been working with all of our entities in Eau Claire as they are looking at reopening strategies and having questions, including the library. They are part of our city team, and city leadership regularly meets, and we're providing updates to that team along with recommendations. And Angie's also available for questions if there's any Chippewa specific. Anything additionally? All right, thank you very much again. We appreciate people's attention. We want people to know that the information available at our health department websites, both the Chippewa website and the Eau Claire, are places to go for more information, and we'll be back on Wednesday to talk more. Thanks.